Can you hear me? Um, I just wanted to check if the volume is working. Um, are you all able to hear me right now? Just feel free to uh, post in the chat or. Anyways, it looks like it is working. Hi everyone. So my name is Snehal Desai. I'm going to just go over some basic concepts and terminology um, for you all, just so you guys are all um, confident before you take this exam. Um, as far as this exam goes, there's a bunch of material that that's very relevant, and I feel like it is time that we do another review session with you all. Previously, we had some tables for you all, so you guys can use this like a review guide. Um, so, just to give you a little perspective here, so you can see here, um, these are some of the topics that I have created for you all, like a list, so you guys can utilize them for your um, guidance. Um, Now, I don't do these things for you all um, very often, but in a while we want to make sure we know all our concepts. So I thought maybe I'd post a little review here for you all. And um, as far as these major topics focus goes, um, you guys are all aware of like cardiovascular, endocrinology, and those kinds of things. But it's also important to also understand the medications associated with these. Um, so, like you can see here, like when it comes to like the cardiovascular literature, some of you have already read some of the newest guidelines from the um, Dyslipidemia 2026 review book. Um, that's a very good source. I highly recommend you all to take a look at that. There are a few updates on there, so maybe you guys want to look at that. Um, Other things I recommend are like the medications and stuff. There's some new ones out there, and um, it's very important to understand some of those as well. When it comes to cardiovascular, you definitely want to look at not just the heart by itself, but also when you look at cardiovascular, you want to look at things that affect toward the heart. Um, think of things like um, you guys probably already know, like some of these, like heparin, for example. Heparin's a blood thinner. Heparin, um, warfarin, clopidogrel. Some of you probably dispense clopidogrel in your pharmacy. And Plavix is one of those very important medications that um, a lot of times patients see that it might have an interaction with some of the other meds that patients on. So it's especially the very critical medication like omeprazole, PPIs. So in a way, when you look at disease state like cardiovascular, and then when you look at disease state gastrointestinal, you could see that there might be some connection between these two types of medications in which their interactions are going to be relevant. So when you look at a patient case on the exam, note the types of drug interactions in there too, because that's very important, especially when you're looking at the CYP2C9, the CYP3A4. Notice another thing, another drug interaction. You read about dyslipidemia guidelines. I'm sure some of you have. You all should be aware of some of the statin medications too. Statin medications. And I'm going to ask the whole audience this, if anybody knows the answer, what is one important counseling point that you should tell your patients before they start taking a statin? You want to make sure, what is that, and what is one thing that some patients like to take, and that interacts with that statin medication. And so I'll list this question here for you all. And we're going to be listing a lot of questions here for you all, so it will kind of help you kind of navigate through the whole structure. When you look at a question on the test, you're not just looking at one disease state. Sometimes the patient may have 3, 4, 5 different disease states. So for each disease state, you need to understand what the interactions are here. So need to know about counseling points. Counseling point is an important blueprint point in the NABP guide. So, and drug interactions too. So we talked about two things here. So drug interaction went on statin and also Plavix. Now we just talked about two of the typical drug interactions between these two drugs. Okay, so those are little things that you guys should understand. Now, in the pharmacy practice, like on the exam, some of you might get a little bit overwhelmed because of the number of drugs that patients might have on the list. But take your time. Always read the question first. See what the question is asking, and then review the list and see what patient's taking, what you know about those medications. The next thing I want to talk to you about is the heart medications. Now, some of the heart medications, like chronic heart disease, that's going to kind of overlap with some parts of the blood pressure as well. So you need to be able to differentiate between like blood pressure and heart types of medications, because some of the medications are going to be very similar, and it's going to be a little bit difficult there, but you guys should be able to understand those kind of medications, arrhythmias medication. One thing about arrhythmias, what do you guys know about arrhythmias? You definitely need to know that Von Williams classification, and excuse my spelling here. Um, um, knowing the um, classes, what class each type falls in. So I have already made a presentation on this. I recommend you review that presentation on our FarmBids YouTube channel. There is a whole breakdown on it, and a complete guide on the arrhythmias and all that. A lot of times when you review DUR codes or DUR screens, you're going to see that sometimes patients have a drug interaction between, let's see, antipsychotics and also the antidepressants. And that falls into neurology and psychiatry section of the exam. So you would need to know some of that and how relevant those medications are as well. Um, Now, another thing is, QT prolongation. You probably see that a whole lot on a in practice. But when you're going for the exam, you may have as an intern seen it as well. So it's very important to note those types of interactions. Antibiotics, I think certain ones like azithromycin and if someone's taking azithromycin or Lexapro, there could be some kind of interaction there. It might be lead to QT prolongation, and patient might experience arrhythmias. Hence, not untreated lead to heart attack. It's very important to understand these types of interactions, understanding what to do. Another thing I recommend you go over is also the types of arrhythmias. Um, and also going over maybe types of angina. Patient has chest pain, right? So they might have unstable angina, ST elevation. All of this stuff falls in the cardiovascular structure of um, the test. The importance of nitroglycerin, nitroglycerin. And what is one thing you want to watch out when you're on nitroglycerin? You want to watch out for nitrates, right? You wanna definitely, you might see this in practice as well. Patients on sildenafil or tadalafil and they're taking it for, um, the um, their hypertension or so you would need to avoid nitrates in this case. Okay, so understand that if patients on nitroglycerin, they're on sildenafil, one of them has to be discontinued because obviously you shouldn't be on nitrates when you're on sildenafil or tadalafil. So those little things are very relevant um, in understanding drug interactions. Um, Let me think here. I also think you all should be aware of certain electrolytes, renal and fluids, especially the renal, kidneys, um, and the liver. A lot of times the liver um, metabolizes many medications. When there's a LFT is going up, that means there's something wrong with the liver. The liver's enzymes are really increasing, might be leading to more of a liver damage. So you want to make sure to understand also the different therapeutic drug monitoring values, um, and all of that, especially when it goes to um, medications and their interactions. Um, so, with that being said, let me move on to this next part here, endocrine. So, endocrinology is things like someone having to take insulin for their blood sugar, someone having a high thyroid level or TSH, knowing the differences between TSH, T4, T3. I believe we have asked a question on the Facebook about this. I recommend you all to review it if you do not know about these um, thyroid levels. The TSH is another value that usually when it's going high, that means your thyroid levels are overall low. So you would have to understand the values and the trends. If you see these um, levels on the test, you need to understand that TSH high means low thyroid. They need to be on a drug that's going to help their T4 or T3 levels to go up because their T4 or T3 is going to be low while their TSH is high. So that's an important point there. Another thing, and I believe you all should know about this, is definitely knowing the difference between, and this kind of falls in the category of um, endocrinology when you're talking about Addison's and Cushing's disease. How many of you know what the difference is here? So you guys need to know the symptoms of these diseases. Cushing's, I would say, is someone having too much cortisol. So CC, Cushing's cortisol. When someone's cortisol is way too low, they're going to have more of an Addison's disease. Um, so, that's one way to differentiate between these two. Definitely moon phase structure and the other way, sluggish kind of symptom and those kinds of things. It's important to understand differences here too. Um, Another thing is definitely the diabetes. Um, Diabetes obviously come in type 1 or type 2. And you guys need to know the different types of diabetes. This is um, a major portion of an exam that I think you all should understand the different type of diabetes medications. You have the Lantus, you have the Lispro, you have the Lispro, you got the Monjaro, and you have medications like Ozempic. Patients usually take these Ozempic and Monjaro once weekly, so you would know that. Going back to the cardiovascular, there's one or two medications here that are really expensive, but you wouldn't be giving this patient a medication unless they were not able to tolerate statins. Does anybody know what medication that is if they're not able to tolerate statins or any oral statin or cholesterol medication? I'll give you guys a minute to answer that. Okay. So basically, if a patient has high cholesterol and they're unable to tolerate statin therapy, um, you would pay the doctor or the prescriber may prescribe um, a higher drug, and I'm going to give you a hint if you guys have heard of the PSK9 inhibitor. Um, this is where a patient might be needing something like Repatha or Praluent. So you would need to understand that as well, that the dosing on these kind of medications, it's usually going to be bi-weekly. So that's important to know and to differentiate between like Mounjaro and Ozempic type of medication. Um, so don't forget about that. Um, Now moving on to the endocrine, knowing also um, about the diabetes is definitely the importance of counseling patients on them. Patients that have been on these medications versus patients who are starting on these medications. You need to know, um, you know, how's the insulin given, or how's this, um, how much sugar is too much sugar. So monitoring parameters are extremely important for the diabetes portion. Diabetes, um, there is always um, a value you would have to look at. So always look at the diabetes or sugar levels, knowing what the before meals, during meals, after meals, understand the A1C. Should it be 6.5? Should it be 7? Should it be 160 for postprandial or preprandial blood glucose? What their levels are. If you guys, one tip I would give you guys on this is, you know, write it down. Write out the um, normal values a patient should have, um, you know, versus normal values a diabetic patient should have when they are on medications. So you would need to know the lab values. Okay. Um, so that's important. So definitely understand the lab values. Definitely understand the importance of some medications. Some of these insulins are long acting, some of these are short acting. Um, so that's very important to know between long and short acting diabetes medications, and also understanding the um, side effects. Some of these medications cause weight gain. So you would need to know what the what medication causes weight gain. Other types of medications, I'm sure you have seen these in practice, or maybe some of you have not. Farxiga, which now they have a generic, which is dapagliflozin. Um, Some patients like to take that, some patients don't like to take it. These types of medications also help with the heart. So going back to cardiovascular. So you would have to look at that as well. Um, Jardians is one of those medications, and I believe I posted that on our uh, Farm Insurance Facebook page. A question on that, so you guys can use that as a review. So Jardiance is an SGLT2 inhibitor, and so it's basically going to be used to, flush out the glucose through urine, and it's it's an important medication as well. Um, and some patients take it for their heart as well. So you might see on an exam that patient doesn't have any diabetes, but they're on Jardiance, and that is okay because they're using it for their heart. So, some medications are used for other things. So you would have to know the indications here as well. So knowing indication. Okay. Going into infectious diseases, you guys need to know the relevance of giving vaccines. Vaccinations are important. What's the one thing some of you have done while you were in community practice? You've been giving shots. A lot of times shots are given to prevent a viral or bacterial infection. So in that case, vaccinations are important here. In infectious diseases. What types of vaccines? You give a Prevnar shot, you're giving a pneumonia vaccine. You're giving a Shingrix, you're going to give someone a vaccine to help prevent shingles. Or meningococcal for meningitis. Just to give you a few examples, you would need to also see you would need to know their vaccination chart and see if they're due for another vaccine. The shingles usually given when usually you would have to wait at least 2 months before giving another shot because it's a 2-dose shot. And so you would need to know that. And now some of you guys have already probably seen and practiced that you don't have to mix dose anymore. You just give the shot directly to a patient for the shingles. But, vaccines also play a critical role in prevention of viruses, but you would also have to see what medication a patient is taking for a virus. Some of you have seen while at work, patients may be taking acyclovir, or antiviral medication, or Biktarvy for HIV, or patients are taking medication like Cipro, or Cipro, or Lexapro, or not Lexapro, I'm sorry, levofloxacin, which is Levaquin. You might see patients on Doxy, and patients taking Doxy for what? You would have to see what type of bacterial infection a patient has or suspected of getting. So you would have to see, is there a specific infection I should be worried about? Patient might have gotten bit by a tick, so it might be leading to Lyme disease. Patient would definitely be started on doxycycline at that point. So, and what else? Z-Pack. And the mechanisms of each of these are going to be a little bit different, as well as the drug interactions that some of these cause. Um, Levofloxacin or Cipro, there might be a chance of maybe cardiac problems or arrhythmia problems. And Biktarvy, which is obviously a HIV medication. And you would need to know a lot of those HIV types of medications too. So, definitely look at the HIV section of the test. And I have a video, and it's a very, very helpful video on this that I recommend you guys to look at. Has a very easy to remember HIV drug list. So I highly recommend you all to take a look at that if you haven't already, because it's going to help you understand those medications a little bit better. The other thing is you want to see what interactions or mechanisms they are, like when it comes to fluoroquinolones, or when it comes to understanding like Z-Pack, which is very commonly given, and where the 30S and 50S ribosome, where it works in, they might have question mechanisms for these, so you would need to know that. And obviously, I talked about the interaction with the Z-Pack with some of the other medications. So, know those interactions. Now, when it comes to the reactions patients have with vaccines and stuff, and allergies is very important. Allergies, I have seen personally, patients might have penicillin allergy, very common allergy. You will have to look in their chart and see, does the patient have allergy? I would say that's one of the first things you would have to look at in the test, is definitely after reading a question, but looking at the allergies. This patient have any drug allergy? They have drug allergy, right? So what is one medication you discontinue? Penicillin type of drugs. And you will change it to something else. So you might have choices saying discontinue amoxicillin, for example, and place patient and initiate therapy for Cipro, recommend discontinuation, something like that. So they're going to have you make clinical decisions, like you're the pharmacist and you're helping a patient. Think of each question like a patient. So you're going to be making recommendations. So you're going to need to know those types of recommendations. Penicillin allergy, patient might have cephalosporin allergy. And this is another allergy I recently saw as well. So some patient having a cephalosporin allergy. This is, kind of putting into perspective like a beta lactamase inhibitor type of allergy. A patient might be just allergic to augmentin because of the clavulanate part of the medication. So you would have to look at the brand and generic version. So know brand and generics, okay? So know the brand and generics of these medications. And while you look at those brand and generics, think about um, things that can influence a patient to get an allergy, like cephalosporin allergy, penicillin allergy, because that's going to help a lot on the exam. Don't just memorize branded generics because they're just there as names. You would have to also look at things like branded generics as if it's going to mean something to a patient in terms of like preventing a reaction from patient having hives or a patient having some sort of other allergic reaction. So brand generics are very important in this case. Um, Definitely know the relevance of a drug that may lead to, uh, you know, other types of diseases. So, um, looking at PPIs or looking at NSAIDs, for example. Um, Certain types of medication might interfere with another medication. So, if patients on a blood thinner, if they're on a blood thinner, and then a patient is put on a NSAID, what do you think is likely going to happen? Patient's going to experience more bleeding. Unexpected bleeding is going to occur. So it's very important to understand that, because of the bleeding risk, patients shouldn't be taking NSAID if they're on a long-term maintenance therapy for while they have undergone stent treatment, or if they've undergone some, um, you know, if they have had a stent put in or they're on blood thinners for lifetime, wouldn't recommend NSAIDs in that case. You wouldn't recommend patient. I mean, some doctors might prescribe NSAID or aspirin. They might not know that they're on that another doctor has prescribed them blood thinners. So you will have to see and analyze that when you're on the exam. Now, in terms of timing of these medications, I would say, if the patient's been on it for a long time, I think it should be okay. Um, but if you have to make a choice on the exam, you will have to make the best choice. What you would do here in terms of helping that customer, that patient, so that they know that there is some risk involved while taking it, but um, if since you've been on it, long term, it should be okay. Um, in case if the patient is not able to tolerate something like Tylenol, and speaking of Tylenol, I want to mention um, that Tylenol. Does anybody know what the max daily dosing is for Tylenol? Okay. So some packages say it should be 3 grams, some 4 grams. You would have to look at the brand generic packaging here. Um, but given, again, understanding that in mind, you'll also have to see their chart if they're on any pain medications, because 90% of patients, well, at least some pharmacies, it's going to be, they're going to be on some sort of pain medication. Hydrocodone, acetaminophen, oxycodone, acetaminophen, Percocet, Norco, so you'll have to see, is Tylenol relevant? If the patient is on pain medication, giving Tylenol, is it okay to give this with their pain medicine? That's where you have to make the judgment whether it meets that maximum daily dosing requirement or not. And so note that down for your reference while you're studying for this exam, because it's important to know the max daily dosing. In terms of respiratory diseases, now respiratory diseases, you're looking at things like albuterol, levoalbuterol, you're looking at salmeterol. In this case, you have to look at the GOLD guidelines. You will have to definitely look through some of these. You don't have to read everything, but at least look through some of the charts in there. The charts are going to help the step charts or the step guidelines. Most of the time, patient might have, as you might see a question on a test, have a patient having COPD, and they're just on albuterol. That's not going to help by itself. They're going to need to have a steroid implemented with that. And you're going to have to see the step guidelines to see, is it appropriate for a patient to be on an additional drug while they're on just albuterol and a steroid and anything else. Looking at that, if they're already on a steroid medication, what steroid is it? Is it just prednisone? Is it just, or are they on a combo medication like Advair, for example? Or are they on another combo medication like, what is it? There's different combo medications will have some steroids in it already. And know the counseling point for steroids. What is one important counseling point when a patient is on steroid? Steroids typically causes what? It starts with T. Okay, so I'll just write it here. So whenever patient is taking steroid, you want to avoid patient from getting a thrush infection, and to make sure that they rinse their mouth after each use. Okay, because if patient has thrush, then they're probably going to need a medication like nystatin to help with treating that thrush. Okay. So patient might have COPD, asthma. Patient might have some other type of respiratory disease. These are the two major ones that I want you all to know everything about for the exam, the asthma and COPD. And also note the interactions here too. Knowing about albuterol, because that's a very common medication as a bronchodilator. It has an effect on beta receptors. Now, it is a beta 2 agonist. It is going to open up the lungs and allow airflow and everything. Sometimes patient is going to be put on a beta blocker, so you would have to look at those interactions there. And realize the interactions between a beta blocker, beta agonist, alpha blocker, alpha agonist, those kinds of things. So PPIs, omeprazole, pantoprazole, lansoprazole, esomeprazole, you'll have to know these types of PPIs, when they should be taken. It's not very big on the test, this PPIs, but because a lot of it is over the counter anyways, but there could be a question or two on this. And, like clopidogrel, omeprazole, or esomeprazole, or any other PPI that may interfere with the CYP2C19 mechanism of like the clopidogrel. So you will have to know the pharmacogenomic interaction here. Famotidine, Pepsid, Alka-Seltzer, Tums, these are all over-the-counter medicines. But patients do take them. And some of these medications do have risk when taken with other medications. So drug interactions between these are important, especially patients might be taking some other supplements that might interfere with absorption or the effectiveness of these medications used to treat acid reflux or heartburn. So take a look at that. In terms of neurology and psychiatry, you're going to be looking at things like antidepressants, fluoxetine, Lexapro, Celexa, sertraline. You might see patients on venlafaxine or desvenlafaxine. So those are important. Also, when it comes to psychiatry, like the medications for that will help with psychosis, like haloperidol or quetiapine, or those medications. Trazodone is another type of medication. Trazodone. Now, sometimes you're going to see patients taking trazodone for sleep. It is an off-label medication, but patients do take it sometimes. Same thing with quetiapine, probably because of their histamine effects. Patients also might be taking other drugs that might lead to arrhythmias. So, definitely take a look at those interactions there. And also note one other thing about the drugs by itself, because the SSRIs and SNRIs, they have different mechanisms slightly. So know the classification between SSRI, SNRI, NRI, and serotonin syndrome that might be caused by some of these medications. Patient could be on tramadol and then taking this type of medication leading to more serotonin syndrome. And so it's important to note and find out what serotonin syndrome is. So definitely I would recommend doing this as your homework assignment, serotonin syndrome. Okay, it's a very big topic I recommend you all to look at, because serotonin syndrome has a role in different types of medication. So take a look at that. Um, and note the different SSRIs, SNRIs, um, and also, note all of that. There was a question on our Facebook page, I believe, whether what medication causes hiccups or, helps treat persistent hiccups. And seems like most of you got it correct. So it is going to be that haloperidol has been shown to cause or help treat persistent hiccups. Not cause, it's treat. It helps treat the persistent hiccups that a patient might have. So that's a pretty interesting um, thing about that medication. Um, I did want to mention another thing going back a couple of bullet points here. The tizanidine. I believe some of you have dispensed tizanidine coming as 2 milligrams and a 4 milligram. Um, you will have to note that and some of the prescribers are very, you know, knowledgeable about this. Um, Tizanidine has also been shown to cause low blood pressure when taken with other blood pressure lowering medications like lisinopril, for example, or losartan. So, it's kind of something you guys might want to just note down for your reference in case it's on a test, which can help in certain case-based scenarios. Um, and on top of that, it's also important to understand, the muscle relaxers can sometimes affect the neurology part as well. So patients might be experiencing more dizziness or drowsiness, and that could be because of some muscle relaxers they're on. Like they could be taking it for their muscle pain and stuff. So um, when you're looking at the chart, one other thing I want you to note is that statins may cause muscle pain, muscle spasms, muscle pain. One thing you'd recommend is definitely, you know, finding out from the doctor about switching patient to another statin. Different types of statins are there. So patient might be on one high intensity statin and they need to be on another high intensity statin. That could work a little bit better. But it's always good to counsel them on this to let them know that muscle pain might occur. Because the way statins work, some of them are going to be like polar molecules. They're not going to be able to um, uh, go through some of these cells or specifically go straight into, um, in general. Because as you've seen in cell biology, cells require for things to go into a cell, they have to go through the lipids, or they have to have that kind of lipid property to get inside a cell. And certain statins, because of the polarity, is not going to allow them to go in. So it's probably going to cause less muscle pain. So you will have to take a look at that. and see what statin might be helpful in, uh, if patient experiencing severe muscle pain. And of course, if they can't tolerate that, then obviously move on to the next step higher, which is going to be more expensive. But if it's going to help prevent the patient from suffering more, then recommend doing that. Um, so the next thing here is on renal fluids and electrolytes. Now, when you're looking at fluids, patient having sepsis, um, if they know what the patient will need to get if they have sepsis, like they're going to need fluids. They're going to need some pain meds probably. They're going to need some other medications to help um, in in treating that severity of the condition, sepsis. So it's all right. We'll take a quick break. I guess someone was here. Okay. All right. I sorry about that. I thought there was someone out here. So I just wanted to see what your thoughts are. Because when it comes to fluids, electrolytes, and stuff, one of the electrolytes you have to watch out for is definitely the potassium. Checking their potassium levels, because potassium is going to be very relevant in many areas here. Um, if patient has chronic kidney disease, for example, they're going to require very careful monitoring of potassium levels. And these are things like check and see what blood pressure medicines the patient's taking, um, like ACE inhibitors, ARBs, things that's going to raise their potassium level. And potassium level, when you're raising the potassium level, is because they need to um, get their blood pressure lowered. Potassium increased, blood pressure goes down. Um, so it's it's interesting how some of these can kind of connect here. Um, so know the potassium levels, what the potassium levels should be, and sometimes the magnesium levels too. Some patients like to take something like magnesium glycinate to help them sleep. And so, you know, taking a look at their magnesium and seeing what, works best for them is important. So, um, magnesium, potassium, calcium, how's their vitamin D levels. Um, Patients get vitamin D over the counter, but sometimes some patients get vitamin D behind the counter and as a prescription, like vitamin D2, 50,000 units um, that they take like once a week. So it's critical, especially for like the exam, to understand the different electrolyte values, sodium as well. Um, Sometimes patient takes something like urea sodium. Um, it's important to understand, the reasoning behind this kind of medications too. Um, and also, it's um, I've seen it in practice as well, so it's important to see, what would be the best counseling patient that's discharged from the hospital and how to manage their potassium levels and all. So taking a look at those types of values as well, those electrolyte values, um, is important. And the medications that increase those values, like I said, ACE and ARB inhibitors, it might increase their potassium level. A patient might be taking furosemide, then their potassium is going to decrease. Um, and so taking a look at some of the drugs that might interfere with the potassium levels is important. Um, so that's that. For the oncology part, the main focus here is really knowing the chemo Venn diagram, and there is a video on that. Um, you're gonna need to take a look at that video and see what those medication side effects are, um, like irinotecan or uh, cytosine, or something that's going to cause those kind of side effects. It's important to know the chemo Venn diagram in this case. And when it comes to cancerous medications, just note the basic knowledge here. What leads to that type of cancer, and know the medication like doxorubicin, for example, and what the side effect is here. Um, and while you're taking a look at those side effects, see what other medicines there are that patients taking that might contribute to worsening that type of side effect. So take a look at that and see how it will, help the patient this way so that they don't experience further side effects and diseases um, from these kinds of medications. Um, so chemo Venn here. There's a video on that. I recommend you guys take a look at the chemo Venn diagram and know everything about that for the oncology section. So don't forget about that. For the hematology section, I would recommend you definitely know the types of anemia patient might be having. Are they very, like what types of anemia this patient might have? Um, like I think it's thrombocytic anemia or leukemia, or one of those anemias. You're gonna have to need to know all these different anemias, what to use to treat it. Should patient be taking iron and vitamin B12? Knowing about that. Um, Iron as well, because some ferritin products might help. So it's definitely important to know the iron tablets here and the vitamin B12 and how it plays an important role in treating a patient's anemia. Um, and in terms of rheumatology and immunology, you guys probably might know a little bit about this already because you've seen it. You probably even use some of the drugs to help with pain and those kinds of things over the counter. Like ibuprofen, Advil, Tylenol, those patients who might have some kind of rheumatology or um, type of symptoms and stuff like that. Immunology. Patient might be having lupus, and then they might need some kind of medication for that. So you have to look at that. Um, so these are not the very hard topics. The ones I would focus heavily on are like cardiovascular, endocrine, infectious disease, respiratory, gastrointestinal somewhat, the fluids, potassium levels, especially, um, neurology, psychiatric, some of those medicines, and oncology. Like this left portion is seems like the most important in terms of disease states. On the right is mostly like other category and NAPLEX exam, men's and women's health, um, learning something about contraception and understanding about like prostate, uh, conditions and those kinds of things. You might see very, very few questions on that because it's not an extreme importance. I mean, contraception, yes, you might see a counseling question on that. So know about emergency contraception and regular contraception and um, menstrual cycles and all of that because that might be a possible question on the test about that. So I'm gonna write it here so you guys can take a look at the you know notes if you ever need it. Calculations, pharmacokinetics, and biostatistics is a must. So do not hesitate to you know just keep going with your calculations practice because on the exam you won't have a multiple choice questions. You might not. You're probably gonna have to type down the answer. So know the formulas for the pharmacokinetics and the calculations and um, memorize those formulas. And I will have some additional practice questions for you all as well. We have a bunch of practice questions on our videos. You guys can take a look at that. You guys can take a look at the top 200 drugs. So you guys can look at the different disease states and everything we just talked about in this short presentation. The biostatistics, you'll see portions already on there posted so you can review the um, like the slides on the different relative risk values, which there's absolute risk values, knowing those um, formulas as well. Because you're going to see questions on that, most likely on the exam. Pharmacy operations, this should be pretty straightforward. It shouldn't be very difficult. It's really just knowing how you're going to do in practice as a profession. And you have to understand like things like understanding informed consent process. When patient comes up to a counter and they want to get a vaccine, a shot, the first thing you want to do is definitely you gotta have them fill out a form. They have to check box the number of questions on the test, um, and basically they're going to hand it to you for your documentation. You're going to need to know all of this so that um, because this is stuff that's going to be in practice. And it's something, that's just like work process. It's the job process. Um, and HIPAA, definitely understand HIPAA is very important, not to disclose patients' information to anyone else. And, having to make sure that they sign whenever they pick up a medication or drug at the pharmacy counter. Um, and taking their ID when they're getting a controlled substance, and documenting everything is important. Inventory is also a very important part of pharmacy operation. Um, Making sure that there's a correct number of drugs on the shelf, um, and pills on the shelf. And, if they might have a scenario question. You, I don't know how all of you do in your practice, but, you know, you always want to make sure inventory is correct. Sometimes patients didn't receive a correct amount of medication. Maybe they receive less. Then you have to make sure that you take care of them and ensure that they receive the correct number of or amount of medication. Um, that's an important part of pharmacy operations. Um, Also making sure the pharmacy is clean and orderly, that all the invoices are filed away, making sure that all of that is done. These are all pharmacy operation stuff. Um, and then compounding, sterile and non-sterile combined, like you would need to know at least the differences here between USP 797, 800, 795, hazardous versus non-hazardous, PPEs, um, personal protective equipment that's used in these types of situations. They might have like a matching question on the test. They're going to ask you to, select the first step to the last step, and then you might have to choose the appropriate response here. Uh, so PPEs in the step in which they have to go in, like the ISO environment. And also the excipients. Memorize those excipients and the equipments. Um, I think you're going to need to know the homogeneous, heterogeneous, compounding mixtures. Okay, so understand about that. Um, and in terms of drug interactions, we already talked so many of these already, but it's good to look at all the, especially in your books, your RX prep books, or what's called now your world ebooks or prep books. Um, Taking a look at all the bolded terms in there, um, in terms of drug interactions. Um, Potassium, for example, it's not just drug interactions, but also drug condition interactions, um, and contraindications. Contraindications, drug interactions, they're pretty much going to fall into very similar categories, so you would have to determine that. Um, Another thing, ketorolac, for example. Ketorolac, you don't want to take it for more than 5 days, okay? 5 days is the maximum patients should be taking ketorolac. Um, and we kind of already hit some of these topics already. Drug-induced diseases. Um, I don't, there could be, like I think we talked about this already, like QT prolongation, um, and like patient with serotonin syndrome, those kinds of diseases. And then pregnancy categories, um, safety, patient might need to take a medication for that's going to be safe for pregnant patients. So, or a shot, if they need a RSV shot, Um, patient might need to get a specific one, like a Briswell, and so that's important to know. And then therapeutic drug monitoring, like looking at things like all the anti-seizure drugs, phenytoin, carbamazepine, um, all of those anti-seizure drugs, um, what their monitoring levels should be, or the range. So, and the warfarin levels too. There could be a question on warfarin as well, so it's definitely important to know the INR values. INR values are very important. Um, International normalized ratio, which is going to typically, if patient has been put on a stent, or if they haven't, or if they're required to be on warfarin, that they have to be between 2 to 3. Um, so that's important, or 2.5 to 3.5, those ranges. Um, so just understand the INR ranges as well. Um, and all right, so I think we talked a lot today. Does anyone have any questions so far? Feel free to add it in the chat box here, and I'll give you guys a few minutes to look over that and let me know if you have any questions. Now is a great time to do that. And if anyone's interested and want a copy of this presentation, it is going to be also posted on our YouTube page, so you can use it as a reference um, while you're studying it. Um, I also think I can, uh, you know, put it on our Facebook if anybody wants it. Um, just feel free to let me know. You can let me know in the chat, or you can comment after this video. Um, I'll just give maybe 10 minutes for questions, and feel free to let me know. And if you're interested and want to read more on a drug, and if you guys have any time, or just for interest, I have a um, I also recommend that some of you guys look into the Pharmacy Times um, website. They have a bunch of information on there. Some of you aren't into CEs yet, but that's okay. You guys can look at the pharmacytimes.com, which has a bunch of pharmacy relevant information on there. They have some interesting articles that I think you guys should take a look at on your own time. It will kind of reinforce some concepts as well. So take a look at that. Um, so with that, we're at 4:58 p.m. right now. So um, I'll give you guys a few more minutes for questions, and then we will call it a day. If something comes to my mind, I will let you guys all know if there's any other tips I could provide. Like I said, definitely read the question first. Look at the allergies, look at the drug list, and the charts. Um, that's pretty much it. Thanks. So, um, so if